Hi, everyone. Welcome to today's Healthy Minds Network webinar. We are so happy that you are able to join us. My name is Sarah Lipson, and I'm the Associate Director of the Healthy Minds Network. And today's webinar is part of a mini-series focused on mental health referrals to off-campus providers. And today we're thrilled to be joined by the founders of the Shrink Space. The Shrink Space is a software platform that streamlines the referral process for counseling centers and students to off-campus providers. And today we're joined by co-founders Aarti, Khullar, and Beth, Jago, and they were inspired to create the Shrink Space based on all of their experience working in counseling centers. And they have a lot of really innovative aspects of their program that you'll be able to learn about today. Before turning it over to Aarti and Beth, I just want to give a quick rundown of how the webinar will work today. So the webinar will be about 30 to 40 minutes, most of that time dedicated to presentation and a question and answer session. You can enter questions and comments using the chat box feature at any time throughout the presentation today. And the webinar is being recorded, and that's going to be available on the Healthy Minds Network website. And we will send an email when the recording is available on the website. So very quick and easy from me, and that's all on my end. And I will turn it over to Aarti and Beth to share about the Shrink Space.
Wonderful. Thank you, Sarah. Thank you, Akila, and the entire Healthy Minds Network for hosting this webinar and for all of your research, which honestly informs so much of our work. We are thrilled to share our service with everyone today, so thank you all for joining. Beth and I are psychologists and co-founders of the Shrink Space. We have experienced the changing student mental health landscape and its referral complexities from all three sides: as student, counseling center staff, and off-campus provider. Beth and I met at graduate school, where we followed similar career trajectories in college mental health. And so for Beth at the University of Chicago, and for me at Johns Hopkins and Boston College. While there, we each experienced the challenges of the university referral system, which are honestly all too familiar for practitioners. We've seen the dramatic increase in student demand for clinical services, the challenges around maintaining accurate referral lists, and how complicated and daunting the referral process can be for our students. Following our time at counseling centers, we transitioned into private practice, where we experienced while we were on a number of university referral lists. During that time, we have seen the challenges of trying to effectively communicate with counseling centers about our practice updates. As such, we believe we are uniquely positioned to solve the challenges because we've experienced them from all sides. And we've created the Shrink Space to do just that. As Sarah mentioned, the Shrink Space is a HIPAA-compliant software platform that facilitates highly tailored referrals. We do this by modernizing your counseling center's referral process, reducing your administrative burden, providing you with real-time visibility into therapist information, and allowing counseling centers to manage the full referral lifecycle. As clinicians, we completely understand that there are complexities and human components that go into making a referral, and technology will never replace this. But we do believe technology can streamline the process. We've thought about this process and considered the needs of each of our users, student, counseling center, and therapists. And we've created a service shaped by our personal and our professional experience in the field. And we're proud to say the Shrink Space is a solution for therapists by therapists. I'll turn it over to Beth now, where she'll demonstrate two main components of our service. The first is in streamlining your referral process, and the second in expanding your provider referral network, both in your area and nationally.
Hi, everyone. Thank you again for joining us today. So I'm going to share an overview of our service, and then I'll get into the site interface and specific features. So when we partner with a university, we'll start by taking that university's existing already vetted referral list of providers and digitizing it so that each provider has their own online profile that is then searchable to students and counseling center therapists. So these providers would be considered affiliated, and this would be noted on their profiles. Then, as an added service to universities, we offer to expand upon current referral lists and fill in provider gaps. So we'll do this by tapping into our own professional networks, associations, and insurance panels to engage in outreach to the surrounding community so that we can recruit more providers who identify as working with emerging adults. And so this group of providers that we would bring on would be considered unaffiliated providers. So we also verify all licensure information of each provider as they onboard, and we make sure that there's no active license. And then each university has the option to either keep their referral list private, meaning that it's only those providers who are currently on the referral list, or they have the option to open up their list to other universities to share in the larger network of providers. So for this demo today, you'll be seeing a provider's profile who will be considered as an affiliated with the university. So as we'll move into the demo here, everyone can see Aarti's screen. We're going to start here on the landing page. So this is where all 3 users would come to log in. And right now we're signed in as a University Counseling Center staff member. So you'll see the search bar in the center of the page. And on the left-hand side, this is an open search field where you can search for anything. So you can type in CBT, anxiety, or if you have a particular provider's name in mind that you'd like to refer a student to, you can put that in there as well. And then you can further refine the search on the right by inputting zip code, city, or even current location. Beneath the search bar there, you'll see a little thumbnail of a video. So this is our animated explainer video that's geared towards students. As you'll see, our site is very student focused, and we've really built this with them in mind. As much of our interface resembles that of like an open table or an Airbnb. And we've really designed it this way intentionally so that students can feel a greater sense of familiarity and comfort when they're navigating the site. And hopefully that we can help to allay some of their feelings of anxiety as they navigate through this often daunting therapist search process. So we'll scroll down. I'll just point out a couple of things in the footer here. So on the right, you'll see a link to customer service, pardon me, on the left. We do provide all customer service to counseling center staff, as well as off-campus private therapists. We do that for students as well, although we found that students are usually pretty good on the technology front. And then on the right-hand side, under the Students tab, you'll see that we've also included FAQs and resources for students, as well as parents of students. And this information is based off of questions that we tend to get as clinicians ourselves. And one of our goals here is to really help educate students to become good consumers of mental health services so that they can feel more empowered to access care, particularly upon graduating when they move into the real world beyond the support of an institution. And this psychoeducation component is really important to us. So you'll see as we go through the demo how we interweave it into various aspects of our site. So let's scroll up and go ahead and do a search. So let's start with a broad search for depression. We'll type that in there. And then let's use zip code 10011 and click search. So here you'll see that the search will yield all these results. These results are randomized, so you won't continue to see the same 5 providers at the top of the list. And then we can further narrow the search here by applying the filters above. So let's start with the accepting new clients filter. From here you can refine to look for providers who are accepting new clients for in-network insurance, for out-of-pocket, out-of-network, sliding scale, or any combination of the 3. And then you're going to go ahead and click apply. Next is the specialties filter here, where you can either scroll down and select one of the specialties there, or you can type in a specific specialty in the box. The price filter here, you can set the range based on student budget. And then the availability filter next here really allows you to hone in on specific hours of a day that a therapist has openings. So I think this filter is really great for the case in which maybe you have a full-time student who also has a part-time job and really has specific limitations around when they can meet with a provider. So let's say that person needed to meet with a provider on Thursday evenings. You can go ahead and check that and click apply. The next piece is the in-network insurance filter here. So you can see we have a pretty exhaustive list of insurance plans. When we onboard with the university, we'll be sure to add in that university-specific student plan. And if there's anything that's not listed here, we're of course open to feedback and happy to add in any other plans that students tend to use. So then if you click on the More tab there, this will pull up a screen that a large focus of it is how the provider identifies. So here, if you have a student who is looking to meet with a provider who identifies as a particular gender, sexual orientation, ethnicity, or language, then you can really specify that here. And just as a point of note, we don't require that providers disclose any of this information. It's all optional based on their level of comfort and how they practice clinically. And then here you'll see the search radius that you can either narrow or broaden based on students' access to transportation. Above that, the university affiliations filter here. This is where you can narrow down your search if, let's say, in the instance where you are meeting with a student who has a more complex referral and you really want to be sure that the student is going to be seeing a therapist who is vetted by you, you can limit that to your specific university. Or in the case where, let's say, you have a student who might be going home for the summer, they live out of state, and you want them to see a provider who has been vetted by another university in their home city, then you can select that relevant university's affiliations. And then lastly, the therapeutic modalities here. So you can specify by medication management, individual therapy, testing, assessment, etc. So we'll click apply. And then once we have applied all of those filters, what you can do here is create a more customized referral list for a student. So you do that by clicking on the star next to each provider's name. So once you've selected the providers you'd like to send to a student, you'll just navigate up and click the Export Referral List button. And from there, that will automatically generate a PDF that you can then email to the student easily or even print out and hand it to them at the end of an intake. And then you can do the same with a provider's profile. So the buttons on the right where it says Export Profile as PDF or Print Profile, that's for the specific provider's profile. One other thing just to mention that we're currently in development for right now is on the right-hand side of the screen. In the coming months, what you'll see is a large map where you can compare the various pins of providers' office locations. So now that we've applied the filters, we'll go ahead and show you what a provider profile looks like. So my profile should be listed in here. There it is. We'll go ahead and click on that. All right, so here you'll see under the provider's photo, there's a little video thumbnail here. So we do encourage all of our providers to upload a short video just describing something about how they work or even populations of interest for them. We hope that this provides more transparency for the student and gives them a greater sense of comfort in the search process. Underneath there, you can see that the provider is accepting new clients or not, and then the payment types that they're accepting, as well as their particular university affiliations. And then beneath the self-introduction section there, you'll see the yellow sticky note looking section, and this is our private notes feature. So this allows an affiliated provider to communicate more nuanced information about the scope of their practice directly to counseling center staff. So providers can also list real-time updates about their referral needs in this section. And this is never seen by a student or even other providers. Beneath that section, you'll see specialties. So we do limit the number of specialties that a provider can endorse so that a specialty is exactly that. Beneath that is therapeutic modalities and a section for group therapy offerings. One thing we found here is that our private therapists really like this feature of having group therapy listed, particularly when they're looking for adjunct therapy for a student they're seeing. They can easily go on the site and do a search for any DBT groups or other types of process groups that they might want to refer their students to. And then beneath there is the theoretical orientation section. If you hover over those, you can see that we offer a brief blurb describing what each of these is. And again, this is in line with the psychoeducation piece for students. And then beneath there is the identity section, a section that lists a provider's in-network insurance, out-of-pocket fees, payment methods accepted. And then beneath that is photos of a private provider's office that you can easily scroll through and get a sense of what that environment looks like. If a provider has multiple offices, they can also add those. And then beneath there, you'll see a map of the provider's office that gives you a snapshot of nearby transportation. You can easily zoom in, zoom out. And then the button on the right where it says Get Directions, this will directly link you to Google Maps. Okay, and then beneath there at the bottom of the profile, you'll see licensure information, credentials, and education. So we'll just scroll back up, and I want to point out a few other things at the top of the profile on the right-hand side. So you'll see here what is listed as a provider's specific availability, so the times when they have openings for sessions listed. And beneath that, you will see the date at which their profile was last updated, so you can be sure that this information is accurate and up to date. Currently, we do email our providers every 2 weeks to encourage them to update their availability, their insurances, etc. And beneath that section, you'll see here is the form submission. So this would be a student's first point of contact with a provider. So when a student is logged onto our website, all of this information listed here, like their name, email address, and phone number, will already be pre-populated. So they'll just have to type in a simple message to a provider, and then they can simply scroll down and click Send Email. From there, that will send a message via our platform to the provider. All of that will be encrypted via our HIPAA-compliant email service. And we incorporated this feature because we felt like we really wanted to allow students the comfort of not having to make voice-to-voice contact initially with a provider. But certainly with this feature, the provider does have the option to either follow up by phone if that's what they prefer. And so one other exciting feature I want to point out here will be the student disposition status. So Aarti, if you'll navigate up to the avatar here, we'll click on that first link that says student dispositions. So here, a student can notify their counseling center about exactly where they're at in the process of connecting with an off-campus provider. So they have the option to list whether they have scheduled an appointment, whether they have connected an ongoing treatment with the provider, or if they haven't connected. And then the student has the option of listing that private provider's name. And one last feature I just wanted to mention that we're currently in development for is student feedback reports to their university about not only their experience on the shrink space, but also their experience with private providers in the community. So once we roll out this feature, this information that students share will not be public, but will only be shared internally with each counseling center. So that winds down the demo portion of the presentation. Perhaps now would be a good time for some questions. And I know we've been given some questions in advance. So maybe we can respond to those first and then take any other questions that folks have. So one of the questions that I have here is, how do you vet providers? So we do verify providers' license is active and in good standing at the time that they sign up. From there, we don't do any further vetting of providers because we don't presume that we know better than the universities do who would be a good fit for your students. So rather, we see it as our role to offer counseling centers more options to expand upon your referral list, and then the counseling centers have the ability to further vet out those options from there. Another question I see here is, if I create an account, does it show up immediately, or does someone review it before it goes live? So the answer is yes. We've recently refined this portion of our service so that we can ensure that provider accounts are verified by someone on our team before that profile ever goes live. And then another question I'm seeing here is, do counselors on this referral source take insurance, Medicaid, or sliding scale? Yes to all of the above. We're also regularly discussing strategies to further broaden access to care for students. So we are working on really encouraging a number of additional providers to join the platform who are the folks that take in-network insurance. So we're definitely focused on that area and trying to expand on that.
Mm-hmm. Yeah. Another question that we had received in advance was a question around our pricing, which we're glad that you asked. And so having been on both sides, we've developed a flexible and a responsive pricing model that fits the unique needs of counseling centers. We understand there are very different needs at times. So we have actually two models. The first is where the provider pays a monthly subscription fee and the university pays a low yearly administrative fee. For our early university adopters, we are waiving this administrative fee through August 2020. So that way you all have the opportunity to try out the service. And then in the second model, the university absorbs the costs of the provider and the provider does not pay. So because our pricing model is based on the size and the unique needs of the counseling center, as well as just for sake of time, we're not going to get into these details right now, but you can feel free to reach out to us directly for more information. We'd be happy to talk to you about it. Another question that we got was around the user experience of the users on the site right now. And so to date, the service has been received very well. We've gotten wonderful feedback from all three of our users. So we've heard from universities that their students are really enjoying the platform and that it's really easy and straightforward and familiar to use. Universities have also been really excited about us expanding their referral list. And so for our first university, we've actually tripled their referral list. Providers have been really receptive to the service because we offer them a more efficient way to communicate with counseling centers, especially during the busy times such as mid-semester. We've also heard from other providers that they're excited to get more access to working with students, and our platform allows for that. Lastly, we work very closely with schools that we collaborate with, and we've integrated a number of their requested features, and we plan to continue to do this for our early adopters. I think that was it with the advanced questions. So perhaps, let me see if I can see a list of the questions right now. Am I seeing them correctly? Okay, so what are some of the things on the horizon for the shrink space? That is a great question. And Sarah, I'm going to ask you to clarify that question a little bit more if you can.
Yeah, I was just curious kind of what the next steps are in terms of expanding and also with the early adopter schools, if they've had any requests or ideas that you're now thinking will be a part of the overall platform.
Mm-hmm. Mm-hmm. That's a great question. And so we are working with 3 early adopter schools right now, and we are in contracts with a number of others nationwide. Then Beth had mentioned a few of the features that we're integrating right now, and so those are very much in conversation. We've had conversations with our providers and our counseling centers about what would be helpful. And so the maps feature that Beth was mentioning, as well as the feature for students to be able to share more about what's to come. And so what is their experience with the shrink space, but also what's their experience with their private providers? And counseling centers really wanting this feedback. And of course, hearing from our providers that, they don't want that feedback to go live or to, be broadcast publicly. And so we're allowing students to anonymously share this information so counseling centers can know more clearly what's going on with their providers and their students after they leave the counseling center. Beth, any other additions that you want to name to that?
No, I think those are the main features. That we're focused on building out right now.
Mm-hmm. Let's see, what else do we have? Yes, can you please provide us a ballpark figure for monthly fee for providers and or typical cost to a university under both models? Mm-hmm. So the provider fee is at $9.99 per month. And the typical cost to a university, as I said, is very specific to a university's size and their unique needs. So we'll ask that if you want to learn more about that second model where the university absorbs the cost, for you to directly reach out to us. Generally speaking, the administrative fee for when a university chooses the provider paid model, it is at a low $500 per year fee to you. Let's see. Is there any way to know how many providers are listed on the shrink space in my area? Yes, we can certainly tell you. We could do a search for you. You are in northern New Jersey. So we can do a zip code search for you. How we usually handle this is, as Beth mentioned, we start by digitizing a university's already existing referral list. And then once we're sort of live with a school, we have found that a lot of providers are really excited to get on board, and that's how we expand upon your referral list, is we do it when we're onboarding with you. Let's see. Have you had a good interest from local providers in joining the shrink space as a paid provider? Beth, do you want to take that one?
Sure. Yeah. So we have done pretty extensive user research in terms of the price that a provider would be willing to pay for a service such as ours. So the number that providers actually communicated to us and throughout all of our research was that they'd be willing to pay up to $50 a month. That being said, we don't, our mission is to help increase access to care for students. So we don't want to prevent any barriers for providers joining onto our service, which is why we've priced it at $9.99 so that we can help to keep those costs low for providers. And we found that basically a provider can recoup the cost of being on our service for a year just within likely 1 to 2 sessions. So we hope that that number is low enough that providers, that this wouldn't be a barrier for them joining on.
Another question is, the challenge is that our providers are full. How do you incentivize providers keeping their information up to date? Yeah, that's a great question. So one of the things that we do is as Beth mentioned, we reach out to our providers every 2 weeks to update their information. We have found that it behooves providers that are full to say that they're currently full. So that way they are not getting referrals that just don't meet their current availability, but allow them to stay on the referral list. And so providers are excited for this because it saves them a lot of the administrative work to call a student back, give them alternative referrals, or reconnect them to the counseling center. And so providers are excited and incentivized to keep their information up to date. And we do it in a really sort of seamless, streamlined way where it's very easy for them to keep their information up to date. And so it seems like providers are really responding to that well. Let's see. Okay. Does the service include any psychiatric providers that accept insurance, et cetera? Yes, it does. And so psychiatrists are able to join online providers that offer online treatment, all sorts of things, individual therapists, group therapists, couples therapists. so all modalities.
Yeah, we do have a number of psychiatric nurse practitioners as well, as far as the medication management component goes.
Mm-hmm. What is the alternative to providers paying a monthly fee? Does the university pay a larger fee which covers the provider listings? Yes. So as I mentioned, the second model allows the university to absorb the cost to the provider. And in so this case, that number is calculated based on the university size and the unique needs of the university. When the referral list PDF is generated and emailed to a student, can it be sent from your server? We do not email students outside of our EMR system, but cannot send PDF within it.
Yeah, so currently we do not have the ability for universities to send that PDF through our portal. That would basically be a PDF that they would have to attach to an email with whatever service that they would use.
Mm-hmm.
We hope that would be a feature that we'd be able to build out in the future. We've been in conversations with a number of EMR systems about their considering right now building an API, which would essentially allow them to integrate our information and our data on our site with theirs. So that's certainly on the horizon for us. That's something that we'd be very interested in so that we can allow for more seamless integration at counseling centers. That is, of course, dependent on many of these other EMR systems. So we're sort of waiting on them on that front.
Yeah. Another question is, what if you find and invite providers to sign up, but we do not want them on our list? Yeah. So this is discussing the difference between an unaffiliated and an affiliated provider. Beth, do you want to describe that difference?
Sure, yeah. So the affiliated providers, these are the folks that would be on a university's referral list, on their current existing referral list. Those would be considered affiliated, and that's listed on their profile. Any of the unaffiliated providers would be folks that are on the site. So if you, as a university, choose to not, you don't want to refer any of your students to those unaffiliated providers that you yourself have not vetted, you absolutely have the ability to do that. You can just limit the search to only your university affiliated providers. And then that way you can be sure that any students that you're referring out are only going to be seen by somebody that you've personally vetted out and that you are comfortable sending your students to.
Mm-hmm. In addition, I'll add to that is you also have the option as a university to keep your list entirely private, in which case you would not necessarily, you'd be able to only see your referral list and not anyone else's, and also not any of the unaffiliated providers that we're bringing on. So that's also an option to you. Let's see. Can you please talk about student responses to having created an account? Yeah, this is a great question. Something we did not have time for in the demo is the student sign-up process, which has been thoughtfully designed by our our UX designer. And he's a millennial himself, and his mother is a therapist, and so he's very well aware of these dynamics. And he's created a very simple, streamlined process for the student to sign up. We ask for very minimal information. We just ask for a verification of their email that they're a real person, and then they can sign up. It allows the privacy around HIPAA, where they're able to then log into the portal and inform you if they choose, which is entirely optional, if they choose to let you know about whether they've connected or not connected with a provider. And so students have not been burdened by that process.
I just want to follow up to the question just prior to this that Cynthia asked. What if you find and invite providers to sign up, but we do not want them to be on our list? Just to add to that piece, if a university has their list of affiliated providers, and let's say they get feedback from students that certain providers have been unresponsive, or you have concerns about their ethical standing, then universities have full control over which providers are on their affiliated list. So they can remove them from that list as they see fit.
Mm-hmm. Absolutely. And you can, of course, please notify us when that happens so we can, use our discretion around whether that provider should be on there or not.
Right.
Yeah. Let's see. Can students access this without going through the counseling center? Yes, they can. If they choose to, it is certainly an option to them. If a university chooses that they don't want that feature to exist for their students, that's a conversation and a customization that we're certainly happy to talk to you about around ways to do that.
Yeah, and just to add to that piece, I think, given our mission to help increase access to care for students, that was part of the reason behind our decision to allow students to access the site, even if they don't go through the counseling center. And we know that this exists currently today, where students can certainly access providers on other sites like Psychology Today or ZenCare. So they would have that ability to do that on our site. But we also encourage students to go through their counseling center to seek the local resources and to have the counseling center be a very integral component in this referral process.
Mm-hmm. Right. We're finding that a lot of counseling centers, realize that a lot of their students might not be connecting through the counseling center, so they find it to be helpful to have an added resource for them. Let's see. Can you reiterate how folks can be in touch with you to learn more? Absolutely. So you can reach out to us through email. You can reach out at contact@theshrinkspace.com. You can also visit us at theshrinkspace.com, and our information is down in the footer to reach out to us directly. And we would be happy to give you more of a personalized demo, talk to you more about any questions that you might have.
And if anyone prefers phone, you can reach us at 315-557-8285.
Mm-hmm. Seeing a few other questions come in. I'm mindful of time, Sarah. Should we're happy to answer them, or?
Yeah, why don't we do these last two questions that are here, and then it's great that folks know they can reach out to you afterwards as well.
Perfect. Yeah. Let's see. Just got my son out. That's good. Can you please repeat costs involved for University Counseling Center? Yes. So there are two models. The first model is in which the provider pays a low subscription fee at $9.99 per month. In this model, there's a university administrative fee at $500. In the second model, I should say first that is waived through August 2020 for our early adopters so that you can try out the service. In the second model, if the university chooses to absorb the cost of their provider, there is, we've calculated that cost in a way that is very unique to each university. And so we just ask that you directly reach out to us so we can talk through what that would look like for you. And it's based on your need as well as size. Okay, can you explain how the first model works? Yes, hopefully I did. If not, yeah, feel free to reach out to us. We're happy to talk to you. Can you please repeat your contact information, or might it be sent to us? Yes, I'm happy to. So it's contact@theshrinkspace.com. I wonder if I can just put it in this message box.
Yep, that works well.
Great.
Great. So we are almost out of time. Do either of you have any final things that you want to say to the attendees today?
Thank you.
Yeah, thank you so much for your time. We appreciate everybody who took the time to join us on this summer day. And we hope to be in continued conversations. We're really open and inviting of more feedback to help improve our service. So we'd love any folks to reach out to us, questions, concerns, or ways that we can make it better. So thanks again.
Awesome. And thank you both so much for sharing everything today. It's so exciting, I think, from the Healthy Minds perspective to be really hearing about some of the most innovative work that's going on. So we really appreciate that and are grateful for everyone's time today. We will be posting the recording of the webinar on the Healthy Minds Network website, as I mentioned, and we will send a follow-up email when that's available.
Great.
So, wonderful. Thank you all so much. Have a great rest of the day.
All right. Take care.
Bye.
Bye.
Bye.